Hi, everyone. Okay, it's 9:45, so I guess we'll get started. Thanks for everyone coming here right now today. This is our Green ICU session, and Sarin and I are your moderators for today. My name is Michelle D'Amico, and this is Sarin Murthy. We are also, aside from being the moderators, the co-chairs of SCCM's Sustainability Task Force. And there are other members of the task force here today and also at this meeting. We just had our first publication a few days ago come out in Critical Care Medicine, so we'd love you all to check that out whenever you get a chance. And you'll see one thing else I want to mention, you'll see some QR codes on some of the slides and kind of hanging out some different places around the meeting. If you wouldn't mind filling out that, it's a very quick survey. It's about leadership in the ICU in regards to environmental sustainability. We would really appreciate your input and your comments. So next, I'm going to hand it over to Sarin so he can introduce our speakers.
Thank you, Michelle, and it's a pleasure to be here. I'm very excited for this next hour. It's going to be absolutely great. We're going to hear some great lessons from some great speakers. First is Dr. Laura Blackburn, who is the Drug Information and Formulary Management Pharmacy Administrative Specialist for Houston Methodist Hospital. And she's going to talk about going green, creating a sustainable ICU. Laura, over to you.
Thank you so much for that introduction and the opportunity to speak today. I have the first of 3 segments today in this 1-hour session for creating a sustainable ICU. The Society of Critical Care Medicine convened a task force last year to develop a report that was just published on Friday, as Michelle mentioned. And as a continuation of this work, the QR code is on this slide. So again, please fill this out so we can see what the status is for leadership in the ICU and next steps. In this first segment, I'll cover the background of green ICUs. We'll cover the importance of sustainability in healthcare, the history of green ICUs, and the green ICU model and its components. So starting off, what do we mean by sustainability and why should we care about sustainability in healthcare? One of the first descriptions of sustainability was from 1987 in the Brundtland Report, sponsored by the United Nations, which called for a balance between economic growth and environmental protection. Sustainability focuses on meeting the needs of the present without compromising the ability of future generations to meet their own needs. That includes not only across demographic, socioeconomic status, and geography, but also considering the temporal relationship with supporting future generations. 2024 is now measured as the warmest year on record. 2023 was previously the warmest year on record, and yes, there are some fluctuations every few years. However, the trend line overall is increasing. With 2024, we have likely seen the first calendar year with a global mean temperature of more than 1.5 degrees Celsius above the 1850 to 1900 average. Why is this a problem? A warming planet, and specifically the 1.5 degree Celsius threshold. The Intergovernmental Panel on Climate Change, or IPCC, which is the United Nations body for assessing the science related to climate change, indicates that crossing that 1.5 degree threshold risks unleashing far more severe climate change impacts, including more frequent and severe droughts, heat waves, rainfall, and flooding. And while the long-term temperature goal of the Paris Agreement is not dead yet, it is in jeopardy. The UN Secretary General emphasized the need for urgent global action with blazing temperatures in 2024, requiring trailblazing climate action in 2025. So what do some of those impacts look like? Unprecedented weather events exacerbated by climate change disrupt critical infrastructure, including electricity, both supply and distribution, water, and roads, which inhibit the movement of not only patients, but the staff and supplies needed to take care of those patients. Working in Houston, there have been several impactful weather events that have directly affected healthcare in the region and others that have had indirect effects nationwide. 2017 was a rough year. Hurricane Harvey along the Texas Gulf Coast made healthcare facilities inaccessible due to unprecedented catastrophic flooding. Some hospitals ended up commissioning World War II-era style duck boats to deliver much-needed supplies. A few weeks later, Hurricane Maria made landfall in Puerto Rico, where it incapacitated the island. including a manufacturing facility, resulting in a nationwide shortage of IV fluids for months. Sound familiar? Skipping ahead to the Great Texas Freeze of 2021, where Winter Storm Uri covered the state, literally all of it, in ice and frigid temperatures where hospitals were without clean running water due to power interruptions and pipe breaks. 2023 was when the EF tornado tore through a manufacturing facility in North Carolina, one that manufactured around 50 sterile injectables, including anesthesia and anesthetic medications. This also impacted supplies for months. And last September, Hurricane Helene blazed a path up the southeast United States and incapacitated another manufacturing facility in North Carolina, causing nationwide fluid shortages that persist today. The extreme weather events in 2025 are already adding up. So if you've been working in healthcare recently and not impacted by any weather events, you are in the minority. A survey was conducted in 2022 to find that 70% of respondents claimed care delivery disruptions, and that projection for the next 3 to 5 years, i.e. now, that number was expected to increase to 86%. I'd say we're on track. There is irony in the healthcare sector carbon footprint. In addition to infrastructure disruptions, climate change has direct health consequences, which is counter to healthcare's mission of improving health. There are both acute and long-term impacts of weather events. Take hurricanes, for example. Acutely, you have flying debris and high winds, heavy rains causing flooding and lead to chemical spills, water contamination, and increased mosquitoes in mold and flooded structures. Fires lead to poor air quality, exacerbating breathing conditions in sensitive populations. These issues, combined with infrastructure disruptions, lead to an increase in the use of emergency department services and have shown to have increased mortality. More long-term physical impacts with a warming climate and pollution are heat-related illnesses and respiratory complications. The burden of disease from climate change has been estimated to be similar to that of medical errors, which garnered national attention decades ago when the magnitude of errors was measured and deemed a serious public health concern. If climate change is causing a similar health burden, should this also not garner similar national attention and action? So what actually contributes to climate change? Most of you are probably aware of the term greenhouse gases, which are infrared active substances and lead to heat retention. Starting in 1990, the IPCC used the global warming potential to enable comparisons of the global warming impacts of different gases. The standard is the 100-year timeline for long-lived greenhouse gas effects. The GWP 100 refers to the relative heat retention of 1 ton of gas compared to 1 ton of carbon dioxide over 100 years. Carbon dioxide may be the most recognizable greenhouse gas. It is produced from fossil fuels, burning, and accounts for 80% of all US greenhouse gas emissions from human activities. Despite their smaller emission quantities, fluorinated gas use in healthcare is important to account for as well, considering their much higher GWP. The chart shows a comparison of carbon dioxide versus sevoflurane, nitrous oxide, isoflurane, a common HFC, and a major offender, desflurane. Greenhouse gas emissions are measured and reported out as carbon dioxide equivalents, where we can estimate the impact that something may have on the environment as a result of direct or indirect greenhouse gas emissions. This is what we call the carbon footprint. Emissions are categorized into 3 scopes. Scope 1 is direct emissions from the hospital, includes things like vehicle emissions and anesthetic gases, which may be vented out into the atmosphere. Scope 2 is indirect emissions from the generation of purchased electricity. Scope 3 is all other indirect emissions, which, as depicted, is the largest contributor, with 82% coming from this supply chain-oriented group encompassing pharmaceuticals, food, water, diagnostics, staff commuting, and waste. Healthcare contributes an outsized proportion of carbon emissions and impacts acute and chronic diseases. 4.4% might not sound like much, but to put it in context, if global healthcare were a nation, it would rank 5th, and that is on par with the food sector. United States healthcare system contributes a full 25% of global healthcare emissions, second only to China. And this equates to 8.5% of our domestic greenhouse gas emissions. When thinking about the 3 scopes of carbon emissions, it may not be surprising to know that hospitals, where intense care is provided 24/7, and pharmaceuticals together contribute around 60% of greenhouse gas emissions. A Lancet commission in 2015 emphasized that tackling climate change is the greatest opportunity of the 21st century for global health. The Hippocratic Oath indicated do no harm and applies to directly caring for an individual patient as well as caring for the environment as a prerequisite for health. Exhibit A is in the 1950s, meter dose inhalers were developed to treat respiratory conditions. The predominant propellant at that time was chlorofluorocarbons, which were found to be ozone-depleting substances, which leads to negative health effects from increased air pollution, which contributes to more breathing difficulties. It's a vicious cycle. CFCs were then eliminated when the Montreal Protocol in the 1980s called for a 50% reduction by the year 2000, which was quickly amended in 1990 to completely eliminate CFCs by 2000, which was successful. However, they were replaced with HFCs, and while HFCs are not ozone depleting, they are still potent greenhouse gases, which is why in 2016, the Kigali Amendment called to reduce HFCs by 80% by 2047. And you may not recognize the term HFC, but you may recognize HFA, which is found in many of the HFC-containing MDIs. Healthcare's carbon emissions and impact on the environment receive less attention than it probably should, considering healthcare delivery facilitates the goals of medicine, which are to prevent, treat, and/or cure disease. In a 2024 Gallup poll, healthcare professionals comprised 5 of the top 6 most trusted professions in the United States. And with that trust comes great responsibility to know healthcare's contributions to greenhouse gas emissions and do our part not to jeopardize the health of the people we are committed to helping. Critical care, as you may imagine, is one of the highest carbon emitters in healthcare. Several studies have analyzed the resources provided to an intensive care patient and found that intensive care is intensive, to the tune of 4 times the carbon footprint of a single person. A life cycle assessment conducted in a United States hospital showed that compared to acute care units, an ICU generates 1.3 times more solid waste and 3.1 times more greenhouse gas emissions per bed day. Medication route has been found to have a dramatic difference as well, with 2 different studies indicating a 60-fold difference in emissions between IV and oral medication formulations. Another reason healthcare professionals are obligated to get involved is because we are problem solvers. Our contributions are problematic, but they are not unsolvable. If a critical care unit can figure out how to make intensive care less resource intensive, the rest should be easier to figure out. So a little bit about the history of ICUs, of green ICUs. Looking into the history of sustainability in healthcare, there has been recognition and efforts over the past few decades. However, widespread engagement has only been evident in the last 5 to 10 years, as you can see here per the publication data. Greenhouse gas emissions garnered national attention 50 years ago with the U.S. Earth Day being established in 1970. About 15 years later, the Montreal Protocol was signed, and 10 years after that, in 1995, the United Nations Climate Change Conference of the Parties, tasked with supporting the global response to the threat of climate change, met for the first time. Following COP21 on Earth Day in 2016, world leaders from a record-breaking 196 parties signed on to pursue efforts to limit the global temperature increase to 1.5 degrees above pre-industrial levels. The landmark Paris Agreement was the most significant climate accord in the history of climate change and the environmental movement, because that is the first time that a binding agreement brings all nations together to combat climate change and adapt to its effects. So where's healthcare been in this discussion? In 2009, The Lancet publishes an article calling climate change the biggest global health threat of the 21st century, and revises it in 2015 to indicate unacceptably high and potentially catastrophic risk to human health. But it also puts the issue in a more hopeful light, to be the greatest global health opportunity of the 21st century. This was followed by a whole journal dedicated in 2017, Lancet Planetary Health. And 2019 is when you start to see critical care bodies start to organize with the College of Intensive Care Medicine of Australia and New Zealand, developing a statement on sustainability in intensive care, medicine, and college operations. The world was a little preoccupied in 2021 and 2022 when over 200 healthcare journals simultaneously published an editorial calling on healthcare professionals to make sustainability a priority. And the Department of Health and Human Services launched the Health Sector Climate Pledge and the AHRQ, Primer for Reducing Healthcare Carbon Emissions. Just last year, the Joint Commission joined in with launching their Sustainable Healthcare Certification. In 2021, a call for emergency action was published in September, when many of us were in the height of the Delta surge. This was published by 231 healthcare journals to limit global temperature increases, restore biodiversity, and protect health. The editorial speaks to the health impacts of a warming global climate and calls on health professionals to unite in calling out governments and leaders to do more now, urgently, to prevent the worst impacts from climate change on human health. Included were journals such as New England, British Medical Journal, and Lancet. Absent were the critical care journals. Earth Day 2022 marked the launch of the HHS Health Sector Climate Pledge. Private sector healthcare organizations could choose to engage in sustainability with the goal of cutting greenhouse gas emissions by 50% by 2030 and achieving net zero emissions by 2050. The commitment involves designing an executive-level lead in the organization, conducting an inventory of Scope 3 emissions, and developing a climate resilience plan anticipating the needs of vulnerable populations in their community. Critical care is rapidly coalescing around the emissions reduction initiative. In the last 5 years, societies of critical care professionals around the globe have started to organize and bring awareness to our contributions to climate change and opportunities for how to reduce and minimize impact for the future. The Australian and New Zealand Intensive Care Society hosted a workshop in 2020 that evolved into a beginner's guide to sustainability, and the newest edition was published in 2024 for how to create a green team. 2023 is when the journal Intensive Care Medicine started a series, My Green ICU Collection, and in 2024, ESICM published their green paper to address challenges and propose actionable strategies. The Intensive Care Society recipe book, a how-to manual of sustainable intensive care practice describing the carbon footprint of all elements of critical care and how these can be reduced, is anticipated to be published this year. And on Friday, a report from the SCCM Sustainability Task Force was released to discuss barriers and outline actionable items, along with opportunities for future impact. And now time for the buzzword, green ICU. The term green ICU is becoming prevalent in the literature and as critical care professionals examine how they can contribute to sustainable health care. A standard definition does not exist, and critical care professionals are still exploring what it means. There are general concepts that support what a green ICU might look like, such as implementing practices and policies that do not negatively impact the environment and reducing the carbon footprint of intensive care while still providing high-quality care. Elements of green ICU would most likely entail a green team, a group of individuals consisting of a champion, an executive lead, and passionate, innovative bedside critical care professionals coming together. To make sustainability initiatives more attainable, they should be embedded into organizational initiatives and quality frameworks to avoid getting dropped or deprioritized. And it is important to set goals, smart goals that are specific, measurable, actionable, realistic, and time-bound, so that you can articulate the why behind the goal, what actions are needed, and who needs to be involved. There are several models that have been proposed when considering how to engage with environmental sustainability in the ICU. Other elements to consider for a green ICU include energy and water, consumables, pharmaceuticals, waste, and fetal treatment. When we're considering courses of action to cause concepts to catch on, alliteration is always helpful, as Dr. Salinas and colleagues have done with their Greater Environmental Sustainability in the ICU paper outlining 4 key Ps as product, processes, people, and the planet. Which brings me to expand upon the Ps and the Rs. A summary of key concepts is outlined in the ANZIC's toolkit for a sustainable ICU with 10 prominent P words to consider a different or innovative approach to determine how to implement the R concepts, which have evolved behind the classic triad of reduce, reuse, and recycle. People have the ability to innovate practices in the name of sustainability and make the changes. They form green teams. They design and implement initiatives and promote public health. For practice and patient care, engage in choosing wisely campaigns, refuse low-value care, and have a less is more mindset. Order only what is necessary to improve diagnosis and treatment. Reduce the need for intensive care by early detection and optimizing management prior to deterioration. For fetal treatment, intentional collaboration with an interprofessional team can avoid the harm to the patient and the environment that fetal care contributes to. For power and water, rethink how we source electricity and transition to renewable energy sources. ICUs consume large amounts of electricity and water. How can we reduce consumption without negatively impacting patient care? ICUs use a lot of products, so for procurement, can we use less? Can we use more durable products or ones that are more energy efficient or have plastic-free packaging? Could we adopt better inventory management practices to avoid wasting products? There are other variables to consider when asking could we switch from single-use to reusable products that would need to be assessed on a case-by-case basis. For policies and procedures, these should bring attention to and support sustainability. Pollution, plastics, waste. How can we reduce and minimize waste to keep things out of landfills or from being incinerated? Pharmaceuticals, mindful prescribing. Think about all the stewardship and deprescribing initiatives, antibiotics, stress ulcer prophylaxis, and avoiding overprescribing. Remember the injectable versus oral preparation conversions when clinically feasible. And lastly, politics. Get involved and engage in advocacy. Part of the change is going to involve the hospital or health system, and there are initiatives that individual units can engage in to pilot and scale. The hard part is getting started, so keep an open mind and check out the Beginner's Guide to Sustainability in the ICU Toolkit for pages of ideas and inspiration. Tackling climate change may seem overwhelming, and it is a monumental undertaking, which means reducing carbon emissions is going to take effort by individuals and organizations alike. So with that, I will turn it over to my colleagues for how to successfully create a green ICU.
Thank you, Laura. Excellent, excellent talk. We're going to hold questions until the end. Next is Alisha Estay, who's the ICU director at Houston Methodist, the Woodlands Hospital, who's going to talk about green ICUs in the United States.
Good morning, everyone. My name is Alisha Estay. I'm one of our ICU nursing directors at one of our hospitals on the north side of Houston. So today we're going to talk about green ICUs in the United States. Particularly, we're going to highlight some of the projects that we implemented in our ICU, how to create that sustainability committee in your organization, and then also we're going to talk about some future projects that we have in the pipeline at our organization. So just kind of demographics, we are a system. We're comprised of 8 hospitals around the Houston region. We do have another hospital coming online next month in our Cypress region, just to kind of give you some demographics. We have about 19,000 patient admissions a year. We are a 25-bed ICU, so we do CV surgery. We're a comprehensive stroke center. We are a magnet facility, and we also are a beacon unit. So being part of a system hospital, I would say over the past decade, we've really tried to create systems among our system hospitals. So that has enabled us to collaborate with what other hospitals are doing. We have a great partnership. We call it our mothership in downtown Houston, where we can bounce ideas off of. Over the past couple years, we've been very fortunate to receive some funding from the Way Foundation in 2023. We utilized that money for staff satisfaction. In 2024, it was kind of a Shark Tank, hey, come up with your green initiative, and the best idea wins. We were very fortunate to receive that grant for the Woodlands Hospital. We collaborated with our bedside nurses on, hey, what proposal can we come up with? And we came up with the saline flush proposal. This is very multidisciplinary. We partnered with EVS. They would partner with us to remove the flushes out of the ICU. We partnered with our sustainability staff. They are the team that looked at the carbon footprint on saline flushes as they have on the environment going to the landfill. And we also partnered with our ICU staff of how are we going to make this work. So we went and looked at usage. So this was important to collaborate with supply chain because we wanted to pick a product that we had high usage of in the ICU that we could make an immediate impact on, and it was saline flushes. If you look at our hospital a year, we use approximately 73,000 flushes a year for the ICU, and then also for the hospital, 700,000 flushes annually. That equated to 15,000 pounds of those flushes that were going to the landfill. So when you look at the ICU and the overall project, we have about, when you look at the flush usage, that was about 4 pounds per day going to the landfill, 31 pounds a week, 134 pounds a month, and about a little roughly over 1,600 pounds that were going into the landfill. So I'm going to talk a little bit about more of the project, some challenges that we faced. So with the project, as I mentioned, we had the money. We partnered with EVS to secure the blue bins for the recycling. We partnered with System Marketing. Anytime we want to do any kind of labeling, we have to go through marketing. And then we collaborated with staff on how we're going to make this work. We chose a different colored bin. Currently in the ICU, we have beige trash cans, so we wanted to choose a different color. We went with Methodist blue, got with marketing for the signage. And so we put those in each one of the ICU rooms. So once we rolled that out, one of my RN3s did the education with the staff in the unit. It was discussed at every day in huddle, and then we went live with this project in the fall of 2024. Shortly after go live, we were rounding, because one thing when you roll out a project, you want to make sure that it's sustainable, it's going to stick. One of the first issues that we noticed was family members were not paying attention that, hey, now we have a blue bin in the room, and they were throwing trash in it. So then we went back to the drawing board. Okay, what can we do next to make this work? So as you can see, the blue bin, it's actually sitting on a countertop next to our red recyclable bin. So we kind of put it out of sight, out of mind for the family members, but it was very close proximity to our red waistband in the ICU. So if nurses are discarding medication, they could easily put the saline flushes in the blue bin. So as you know, nurses use a lot of saline flushes to medication administration. What happens if you get a little bit of blood in the saline syringe? So with partnering with the recycling company, they said we could easily just rinse the blood out and it would be good for recycling. So that's what we educated the nurses to do. Ever since then, we've made the change of moving the recyclable bin on top of the counter. We have had great success because our plan was we had enough grant money to not only implement this in the ICU, we also had enough money to implement this in every inpatient unit in the hospital. So we're going to talk about more of that in a minute. But the biggest thing was consistency with the recycling and also strategic placement of the recyclable bins. So kind of the future state of the project, we rolled this out in the fall of 2024 in the ICU, worked out all the kinks, have a great initiative going. We wanted to roll it out in the rest of the hospital. 2 weeks ago, I attended the Childbirth Center staff meeting, discussed with them because we wanted to roll it out in high usage areas, which included childbirth, OR, and IMU, and the ER. So by end of Q1, we will roll it out to the OR as well. And then the end of Q2, we're going to roll it out to the emergency department and all of the inpatient units. And then what's next after that? So we want to look at recycling nasal cannulas, face masks, IV saline bags, anything else that we can work with our recycling company that can divert those items from the landfill. The other part with creating a green ICU is sustainability through reprocessing. So we partner with our major supplier of the hospital who brings us all of our supplies. And we look at the items that we currently supply and how well are we recycling or reprocessing them. So if you look at 2023 compared to 2024, we saved about $90,000 with reprocessing equipment. So for items in the ICU, this is your pulse oximeters. These are your reusable EKG leads that we use with our CV surgery patients, and then also our hover mats that we use for patient repositioning. We had a meeting with our supplier 2 weeks ago. We know in our hospital we probably have some knowledge deficit with newer nurses on recycling, and we are looking at getting more data on what is our current usage of these items and how well are we reprocessing and recycling them. So that's going to be our next partnership with our major supplier. And so this slide kind of represents our system as a whole. As you can see, we diverted around 21,000 pounds of supplies from the landfill in 2023, and this year for 2024 was about 24,000 pounds. So 13% improvement. Also saves the hospital some money with renewal and reprocessing at those items. But we will have, like I said, we have a really good partnership with our supplier, and they're going to come back and do some re-education with the staff. So I kind of want to expand not only the ICU, but how do you get involved? So sustainability through green initiatives. So we're very fortunate at our hospital to have a sustainability committee that aligns with our shared governance. They meet monthly every Thursday. We sought out green leaders across the hospital. This isn't just physicians, it's not just nurses, it's EVS, it's housekeeping, it's supply chain, it's pharmacy, it's all those partners to get involved. You would be surprised of how many ideas the bedside staff, EVS workers have. So it's important to get all those people in the room. Building those vendor partnerships with your suppliers to learn about what items can be reprocessed, the recycling companies, what items they're willing to take. And then how do we make a community impact? So we kind of have some fun things scheduled throughout the year, Adoptable Family, performing a sustainable food drive for the community, a coffee ground initiative. Everybody loves Starbucks. We have a Starbucks within the hospital. So they're partnering with us for those used coffee grounds that we're going to be able to repackage and the staff can pick up for free and take home to use in their gardens. We also had a sustainability fair 2 weeks ago. So staff, we had the vendors come in, staff could learn more about all the items that we're processing, how their impact at the bedside makes a difference, because they're the ones using the supplies, they're the ones taking it to the soil utility room for processing, and also doing monthly socials to get staff involved. This includes our wellness partners within the organization. So this kind of just wanted to highlight the slide of our Green Leader campaign, how to become a green leader. This was sent out to all the staff in the hospital just to kind of get them excited in the green initiatives and all the work that we're doing at the hospital. And like I said, this has been in partnership not only at our hospital, but also the system. So if we can do it, anybody can do it. You would be surprised just at the simple things that you can do at your organization. One of our big initiatives right now is our crash cart revamp. I know myself, along with another hospital, looked at all the items in the supply cart to see what we could get rid of. And we were able to eliminate a lot of waste, because as you know, when you open a crash cart for a patient in the room, all those items in that drawer have to get thrown away. So our system right now is looking at every crash cart across the system. We have a meeting coming up next month, and we will go one by one item in a crash cart of what can we eliminate, so that way we can reduce usage. So just a great idea for something if you haven't done that at your organization. And so this is my last slide, just to acknowledgement of our bedside staff who has become a part of the Green Initiative. Our EVS director, Jason, helps us with determining that carbon footprint on admissions into the environment. And then Valerie heads up our sustainability chair at the hospital. Thank you, everybody.
Thank you, Alisha, for that great talk and all the work that you're doing at Houston Methodist. Also, thank you for staying on schedule, because we're intensivists and we're all impatient. So that's perfect. I'd like to introduce our next speaker. Her name is Dr. Megan Gooch. And Megan is an intensivist in the cardiac intensive care unit at Houston Methodist Hospital. She is also on our Society of Critical Care Medicine Sustainability Task Force, as well as Laura. And I've roped her and Laura into doing podcasts with PCICS on sustainability. And she's a wonderful person to have representing Houston Methodist Hospital, as well as our colleagues here, Alisha and Laura. And thank you, Megan, for coming.
Thank you for having me. So I'm Dr. Megan Gooch, and I'm going to talk to you today about how to create a green ICU at your own institution. So I don't have any conflicts of interest or disclosures for this session, and these are my learning objectives that we are going to go through. So first, we're going to talk about the steps to creating a green ICU. So while I go through these steps, I want you to think about, how can I do this at my institution? This is going to be tailored to what works for your healthcare system. There are no rules to green ICU. This is just meant to be a simple guide. So first, we're science-minded people. We need to start with our metrics. Why is this important? It's good to know where you're starting, set goals, know where you're going. So first, you want to obtain your carbon footprint baseline for your system, for your ICU, which can be challenging. Some places have a third party that will come in and assess their carbon footprint, but you do want to involve your operations and facilities managers, because, as Laura said in her talk, that the hospital has so many factors that go into our carbon footprint, so you don't want to miss anything. And then next, you want to have project-specific metrics. So I'm just going to give you some examples of projects that we have discussed and talked about doing with our metrics, but you might want to just get anything you're thinking about doing, get the metrics for that, so you can even see where your biggest problems lie to see where you'll have the largest impact. So for instance, looking at the number of labs you draw per day in your unit, looking at the amount of unused medical supplies that go into the trash can every day, looking at the weight of the different types of waste that's disposed, looking at how much oxygen you use in your unit. And then next, you want to perform a life cycle analysis for higher utilized supplies. And I'm just gonna briefly talk about what this means because I actually took my slide out with the demo, or with my cool little graphic. But essentially, a life cycle analysis is from cradle to grave of one supply. So think of an ET tube. You need raw materials to make this. You need to manufacture it. You need to distribute it. And then you use it, and then you waste it. So you either reuse it, recycle it, or throw it in the trash. So every single step of this process has inputs and outputs, and you need to be aware of that. So next, let's create our team. And I'm sure you can tell this needs to be multidisciplinary. The ICU team is multidisciplinary, so the green ICU team should be multidisciplinary. So just some people to think of having involved. Physicians as well as your trainees, think of your residents, fellows, even get the med students involved so they're aware of this being something that should be part of their practice pattern going forward. Your APPs, nursing, RT, pharmacy, and you want to involve all units and all sites, especially if you're a large healthcare system like we are. We have brought in our sister hospitals and all of the ICUs in our system, so everybody is involved. But also, I'm sure you've also realized that there's a lot of non-clinical staff that we should have involved in our projects as well because they're going to be instrumental in helping us move forward. After you get your team, you want to break them up into work groups. This will help organize your team. This will help have them different focus of different categories, and you're going to want to pick a team lead for each project. So I'm going to go through examples of different work groups that you may want to have. You might think of different ones. You might think of more categories than I list. But I just, again, encourage you to think of who at your institution would be good to bring into your work group. And some of these things are going to seem simple, and some of them might seem a little bit more challenging, but that doesn't mean it's impossible. So first, I'm just going to lump these two together, the energy efficiency and water conservation work groups. So these work groups are going to focus on the energy used and the water used in the intensive care unit. And some things to think about is involving facilities and talking about energy efficient HVACs, LED lighting, automated lighting that turns off when nobody's around, low flow water systems, energy efficient water systems. But also for your clinical staff, you want to encourage them to turn off things that they haven't been using. Think of what you put in standby mode and not power off, and then you don't use it for days to weeks. Or if there's a section of your unit that there aren't any patients there, maybe turning those computers off until somebody's being readmitted. And then with water, just being aware of how long you're running the faucet and any high utilization treatments that involve water, such as dialysis. This next one is going to be a big work group, and I would suggest maybe even breaking it up into smaller subgroups because most of our projects have fallen into this category because we use so much waste in the intensive care unit, and this is something very tangible for staffing, the clinical staff, to see their impact and see what we're doing. So just for some examples, reducing medical waste and plastic use, transitioning to reusable medical equipment. And this is something that I want to pause and tell you to consider the life cycle analysis of your reusable, because sometimes the sterilization and processing of that reusable is more of a carbon footprint than throwing it away, unfortunately. And there have been several studies looking at LMAs, disposable and reusable gowns. So I encourage you to look at the literature and see what other sites have found. But this is going to be very specific to your unit, which suppliers you use, how they distribute it, where your distributors or where your suppliers located. If you're getting something that's from outside of your country, the carbon footprint for that reusable might be higher than getting a single use from within your country. Looking at reducing low-value care testing, things that we just order out of habit. Does everybody need a daily chest x-ray? Does everybody need labs every single day? Do we need to still have these Q6, Q8 labs if everything's been normal for several days? And looking at the reduction of unused medical supply waste that was brought into a patient's room, but nobody opened it, and now we can't use it for anybody else because it's considered contaminated. So let's talk a little bit more about what we're doing at Houston Methodist in terms of waste reduction. And I know Alisha gave a good example of something they're doing at the Woodlands campus. But we have found that one of our ICUs in a 6-month period consumed 1,464,262 supplies. That's a lot. We use a lot of stuff in the ICU. So what are some things we looked at doing? Changing pre-made procedure kits, looking at the central line insertion kit. Do we use everything in here? Maybe we should get rid of the things that we don't use and that we throw into the trash after our procedure because nobody ever uses it. Adding a procedure cart to the unit instead of going to the supply closet. Because if you're going to the supply closet to do a procedure, sometimes you just take more things because you want to make sure you have it at the bedside because you don't have to send someone running back and forth. So if the procedure cart's outside the room, accessible, then you're less likely to need that safety net of having all of your supplies at the ready. And similar concept, having an airway box for intubations rather than running back and forth to the supply closet or bringing more things in for the intubation just because you feel like you might need a backup. And reducing the inappropriate opening of the code card. If somebody's opening it just to get one medication because it's right there instead of going to the Pyxis, or if you're using the airway supplies in there to do an intubation that's not emergent, or if somebody just feels like, oh, this patient's crashing, I just need to open it just in case, just having that education to tell people, no, we don't need to be utilizing this as our safety net, just open it when it's appropriate and have the other things that they need readily available. And not quite a supply, but looking at how much oxygen you're using. So I want to talk to you a little bit about a project that we did in our unit that was nursing driven. So as I said, we found that there were a lot of unused medical supplies that were considered contaminated once they're brought into a patient's room. So otherwise, this would have went into the trash. So over an 8-week period, our nurses collected, and you could see they ended up under a nurse manager's desk, all of the supplies, and they found over 1,700 unused supplies, and they estimated the cost of that to be about $700 per week, which you can extrapolate to be greater than $35,000 that go into the trash per year. So their intervention was educating the staff, telling them, you know, this goes in the trash when the patient gets discharged, transferred out of this room. Maybe we should be a little bit more aware of what we're taking into the room. So over time, they had an average of 400 supplies that were taken to the trash per week, and they were able to reduce that to 200 per week. So they cut it in half, which was wonderful. And then since we were told by infection prevention we were not allowed to reuse these supplies, we were able to partner with a local charity that were willing to take the unopened supplies. So that was our waste management group, and I'm sure you could tell there's a lot of work to be done in terms of waste in the ICU. You also want to utilize your pharmacy team, have a pharmaceuticals work group, and look at the reduction of pharmaceutical waste. So go through the patient's medication list every day, discontinue medications that are low-value care. Does this patient still need GI prophylaxis? Do they still need this olanzapine from 2 weeks ago when they were delirious, but now they're better? Do we really need continuous IV fluids running on this patient? And you also want to engage supply chain and have a work group that focuses on finding some sustainable products with sustainable packaging, eco-friendly materials, and maybe even having a recycling program, whether it's the supplier that has a recycling program or some of the device companies have recycling programs, such as some ultrasound companies, some video laryngoscope companies. If you have a prior product from them, they're willing to take that back and recycle it and give you a discount towards a new device. And then for your extroverts and cheerleaders, the staff engagement and education committee. So this will empower your ICU staff to have the knowledge about sustainability and involve them. So they'll have educational sessions and workshops, have a sustainability campaign at your hospital so everybody knows that this is happening. Encourage grassroots initiatives from your unit, and celebrating the people who have put in the hard work so everyone knows that these people are getting recognized. Look at what they're doing. Be loud about it. Say, hey, this person did this amazing project. Look at the impact that they've had. And maybe have Green ICU awards every year for the best unit project, the ICU champions for Green ICU. Just some things to consider. So once you have your work groups, and a project in mind, you may want to do a process walkthrough. So this would involve identifying each step of the process and then speaking to the stakeholders in each step of the process to learn more about what their perception of the problem is. They might be able to help you identify more problems, but they can also help you come up with solutions. And they might think of things that you didn't even know were possible or didn't even know were happening. And this can also act as an audit. So you can do a process walkthrough before, during, and after to see how things are going at the 6-month, 12-month mark. So you make sure that these initiatives are sticking. So next I'll talk about how to form a green ICU toolkit for your own institution. And again, this is going to be a little personalized to your institution, but you want to have the inventory and the audit for your unit of your green initiatives. Having a resource database of your partners, your EVS liaison, your supply chain liaison, and any information to easily contact these people. Your action plan template, if somebody comes in 5 years from now and they want to get involved and they have a project in mind, perhaps having a template for them of how to get started. And having some different monitoring and reporting tools so it's more standardized in terms of how each group reports out. And forming your green ICU manual, perhaps putting it all in a binder or handbook and distributing it to each ICU so everybody can reference it. So of course, nothing comes without challenges, and there's some barriers to green ICU, and some are more difficult to get through and some are less difficult to get through. So one of the big ones is the high initial cost, especially if you're trying to champion things like energy efficient HVAC, solar panels, but you want to do a cost benefit analysis of these things. And this isn't something you're going to be able to go to your hospital tomorrow and say, hey, let's put solar panels on the roof. But this is something to keep in mind so you can start doing the research and start advocating for, hey, if we have new construction, if we're renovating, maybe we should do this. Look how much money we would save over time if we install these things. Next is regulatory challenges for any regulatory bodies that might have some conflicts with what we want to do. So for instance, infection prevention, when we're like, hey, can we really use these unopened supplies? The patient wasn't on contact. They're like, no. We're like, can we maybe recycle them? And they're like, no, that just needs to go in the trash. That's our policy. So you need to work with these groups, work with your infection prevention, work with your quality groups, just so everybody's involved and everybody's on the same page. And again, they can help you with solutions. And then you may have some logistical barriers, such as difficulty sourcing sustainable products or suppliers. So you want to work so closely with supply chain. And again, this is something that you want to do research up front, so when it's time to have a new contract with a different supplier, you could say, hey, actually this supplier has more eco-friendly materials that might be cost-saving over time. So there are some things that you're not going to be able to do immediately, but gathering your information and being able to find the right people to speak to and put this in their ear so when it comes the time to renew contracts or have new construction or find a new supplier, they're already thinking about it. And they might even contact you and say, hey, last year you said something about eco-friendly. Can we talk about this again? And then in terms of staffing, general lack of awareness and understanding of what the sustainable practices are, why it's important, maybe some misconceptions about green ICU and thinking, is it even worth it? We're just one person. And also resistance to change, which comes with any new initiative. So the solution to both is going to be engaging your staff and having educational sessions and having your campaigns and maybe even telling them about small pilot projects that you've done throughout the system and say, hey, the nurses up at the Woodlands did this saline recycling project and look at the impact that they've had and look what everyone's doing. So I know that this was a lot of information, and if you were interested in more, I just want to tell you to save the date for our first annual Green ICU Symposium that we are having in Houston, Texas on September 17th this year. And also invite you to our National Green ICU Collaborative that Dr. Masood has started. And here's a QR code if you are interested in hearing more about that or looking at our joint statement. So I know this can be very overwhelming because there are a lot of things involved in becoming green. But you don't need to do this all today. You can start small. You can build your team with just a couple people, and as you gain momentum, more people will be interested. It's going to take a village, but we can all do this. So my last question for you is, are you ready to make an impact? Thank you for your time.